What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, maybe it was RSV or some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, November 7th, 2024. If you're new to my channel, first off, welcome to my channel. You just clicked onto today's virus update. Don't know what the virus update is? Well, let me explain. The virus update is where I talk about all the various different viruses that could make us sick. There's a lot of them out there. You don't hear about them enough on the news, especially COVID. COVID is something that is still causing problems. People are still testing positive. People are still being hospitalized. People are still going on to develop long COVID. People are still ending up in the ICU, in the hospital, and unfortunately, people are still dying of COVID. What's long COVID? Maybe you've never heard of it. Well, are you having a new health problem post-COVID, or are you just not recovering from your case of COVID like you should be, and you're continuing to be sick? That is long COVID. There are hundreds of different symptoms that make up long COVID. Each and every day it seems like we learn something new about what long COVID can do. And you need to be informed on all this, including those other viruses. In a moment, we're going to talk about whooping cough, which is a problem. And each day that I do my updates here, we talk about the news stories. We do some daily data. We do wastewater updates. We talk about Walgreens, which shows COVID positivity levels. And we do go into other countries as well when I find stuff there. And of course, I give you the COVID cases and deaths in the United States. We do talk about COVID hospitalizations and other stuff as well from the CDC. All right. If you're new, subscribe down below. Give this a thumbs up, hit that notification bell, and share this video with anyone you know. Starting off in Tompkins County, New York State, where whooping cough and walking pneumonia is on the rise. It looks like, as of right now, there have been 13 cases of whooping cough so far this year in that county, so never a good thing to see any cases, but 13 cases is what they are reporting there right now. In the United States, the U.S. reports 3 more human cases of H5N1 bird flu, including 2 in Washington and 1 in California. This is a number that has been steadily going up throughout the last month. We've been seeing several cases show up, but there is good news. And the good news is that so far in the United States, with all these human cases, not one human has died of H5N1 bird flu so far to this date. So that is good news, but what is not good news is that we are continuing to find more cases of this, and more cases are popping up. Alright, this is also interesting. Recent COVID-19 vaccination tied to lower risk of long COVID. New data from VENUS, VENUS, Vaccine Effectiveness Networking and Universal Safety Study in Japan reveal that the risk of developing long COVID is significantly lower when people have been recently vaccinated before infection. This study was just published yesterday. Want to read the full study? It will be making it to the archive of studies on my website. So, hey, that is some good news. In Mississippi, they announced a new CWD detection, chronic wasting disease detection in Marshall County deer. Yes, it's something that's been popping up in many counties across the United States, and where I live here in Pennsylvania, in central Pennsylvania, out there, it is a problem. We don't have it here in southeast Pennsylvania just yet, but I'm concerned eventually it may make its way towards this area. Alright, I have to show you something that I saw last night. So last night, after I ended up posting yesterday's virus update, I said, let me go out and do a few deliveries, and long story short, that turned into me being out for quite some time. Anywho, the first delivery I did, it was going to a long-term care facility, a rehabilitation center. Upon delivery, I was masked like I always am. Upon delivery, I see a sign on the door. Look what the sign says. Attention visitors, and, well, let's zoom in. Yep, they were dealing with a COVID outbreak, and I believe the name of the place is Elkins Park Crest. So, yep, they're dealing with a COVID outbreak at that facility. It just goes to show you COVID's not over, and even when we're in a law, which we are still kind of in a law at the moment for COVID, yeah, it may be trying to go up slightly, but even in laws, there can be COVID outbreaks. Really anywhere, long-term care facilities, hospitals, schools, anywhere at any time can have a COVID outbreak occur. So something I wanted to share with you. And in case you're wondering, the person that came to receive their order, don't ask me why, they were maskless. I mean, your facility's having an outbreak, and you think you would try to keep yourself and the rest of the people safe so you could get the outbreak under control. But here we are in 2024. We still just do not understand it or get it. Alright, let's take a look at the latest update from the UK. Good news there. Cases are down. 2,149 cases reported. That is down by 792, or 26.9%. As of October 26th, the positivity rate was 11.1%. We're going to have to not look at healthcare and not look at deaths. You can see here, take a look. These numbers have not updated. The most recent update, which would be October 25th, I believe that's last week. I could be wrong. Someone correct me if that is a new number. Deaths, 266. That's up by 34, or 14.7%. Number of people in healthcare, which it says here, up to September, what is this? Yeah, September 28th. That's way behind. So that 2,622, you see? Yeah, don't pay any attention to that because it is just far behind at this point. And let's see, can we look at other viruses? They constantly always try and change things here. And usually we do look at, nope, it's all just COVID on this page. Maybe tomorrow I'll try and get up the RSV and other respiratory viruses on the page for the UK. Taking a look at air qualities in the United States, and you're going to see something that's not so good, or at least I would think you would. There's a big wildfire ongoing down in California, and oh yeah, take a look at that. It is showing up just to the northeast of LA. You can see air qualities are bad there, but let's zoom back out. I just saw something else that I'm just noticing today. Take a look at Washington, Idaho, Oregon. Just a large area of really bad air quality. So if you're in that area, please be careful. And there are a few yellow spots mixed in throughout the rest of the United States. Alright, want to learn more about climate and weather? You can do that over on my X page, Climate Data Report. And you can also follow the same account. It's actually spelled out completely over on Blue Sky. Alright, I did post my weather video for today, and you can go check that out. We're talking about maybe potentially finally a pattern change in the Northeast. Now, it's not going to be anything substantial, but maybe a few days will be mixed in that actually feels like fall, and maybe a few chances of rain in the Northeast, where we are really in a bad drought right now. In fact, New Jersey is now in the extreme drought category, which is not good. They need to be conserving water at this point. Philadelphia yesterday had a lot of EMS calls, 883, and I would be surprised if it's not the same today, because I've heard a lot of ambulances, but who knows? There's been days where I've heard a lot of ambulances before, and it turns out to not be a busy day. The suburbs have been really busy today as well. Taking a look at Montgomery County, Pennsylvania right now, and I'm seeing not one, but two cardiac arrest calls. I'm seeing one in Montgomery Township. I'm seeing another in Lower Providence. I'm seeing diabetic emergency, cardiac emergency, multiple times, respiratory emergency, and over in Chester County, Pennsylvania. You may not see it right now, and you don't. You see only one respiratory difficulty call. I have seen dozens of respiratory calls there today, so I don't know what that's all about. Was listening to Center County, Pennsylvania earlier today, and I did hear the words COVID positive within calls, they're saying. And note, the patient is said to be COVID positive. So, yeah, COVID is out there here in Pennsylvania. Take a look at Pennsylvania wastewater. It's rising in Chester County, Pennsylvania, at least at one of the wastewater sites, and is significantly rising, or so it says, over the last 15 days in Indiana County. Remember, a lot of these colors you see here are not matching what I'm finding on these charts. I still can't understand why it's doing that. Taking a look at what's going on in Canada. The viral activity level for COVID is moderate. The viral activity level for flu is low. Flu B is not detected. RSV is moderate at this time. Walgreens in the United States for today reports the positivity rate is 14.1%. That's a difference of down 1.8%. This is for COVID. Alright, let's take a look at what's going on with some wastewater, and I do need to refresh. This will do 2 wastewater sites today, and I can think of 2 off the top of my head that we probably have not looked at in a while. One being up in Maine. I want to know what's going on up in one of the northern states. So let's find out. Let's go to Portland, Maine, and see if any of those seasonal viruses are starting to rise yet. COVID is listed at medium. It's not rising all that much. In fact, it's not dropping all that much either. It's really just bouncing off the bottom. RSV is low at this time. Influenza A is low. Influenza B is low. HMPV is low. Norovirus is flat at this time. And we can see there are some detections of hepatitis A at this time. Let's also go down to the south now. And we have not talked about, where is it? Here it is, Alabama. We haven't clicked on any of these wastewater sites. Well, let's go to Village Creek, and I'm seeing COVID listed as high, and oh my, take a look at this. Since the middle of October, yeah, wow, you are really starting to see a rise for COVID at this point, but we do note here, or at least I note, there's a theme here. Not only is it COVID that's really rising, RSV is going up, Influenza A is going up. Not seeing that same trend with Influenza B or HMPV at this time. Norovirus is slightly going up, listed in medium, but yeah, those 3 viruses, Influenza A, RSV, and COVID, significantly rising, both still low for Influenza A and RSV, but I'm concerned how fast your COVID levels are going up, because this is rather unusual for this early down in this area, and in fact, I actually do want to look at something if we can here. Can we go back in time? Yes, we can. I want to see how bad your summer wave was. And, alright, you did have a significant summer wave, and to see that your COVID levels are already going up this fast, yeah, that's concerning. We're going to have to keep our eyes on that particular wastewater site. Anytime I find a wastewater site or a cluster that are close to each other that all rise like that, it usually signals something is going on. I'll investigate the other wastewater sites in that area off camera and report back to you. Alright, all the CDC data will be updating again tomorrow. Still no hospitalization report out of New Jersey, but on their dashboard for emergency department status, I do note that there is one hospital that is listed at full at this time. Cooper University Healthcare, this is in Camden County, New Jersey, is saying their emergency department is currently, they're full, total patient volume. They're not taking anything except for, let's click on this show, and it says, it does look like they are still accepting stroke and trauma at this time, but overall, avoid that hospital. You're going to have a bad experience. You're going to be waiting for a long time if you need to visit that particular hospital in the state of New Jersey. New York State, which does include some New York City data today, 740 cases. And if we go back to, I believe this is last Thursday, that's down once again. New York State is still dropping at this time. Now, taking a look at what is going on with their hospitalizations, did not change today. The hospitalizations is the exact same number as yesterday. 586 versus 586. And 63 in the ICU. That number did change. I think that will eventually get corrected, because we've seen this before, and they end up correcting the number. It's probably not that much of a change, though. Ohio did update today, and good news in Ohio. Look at this. The cases in Ohio started dropping once again. Last week they had 2,779 cases. This week they report 2,491. Hospitalizations are down. 83 added to the total since the pandemic started, which is 155,113 hospitalizations. That's a lot of people in Ohio that have been hospitalized, and that's with missing data too. So, wow. In the ICU, same numbers last week, 7, and a 3-week trend for deaths, as we see here. It was 18, then it went up to 29. This week, they report just 23 deaths, so that is some good news. All right, in Colorado, now it's showing here down 25 for COVID hospital admissions. That is not correct for some reason. This 72, I believe it was 69 before, so that would actually be up by 3. Again, not a major change. 72 admitted for COVID. Influenza, 7, that's actually down. And RSV, 5, that's up by 2. Emergency department percentage for COVID, 0.7% have showed up diagnosed with COVID, 0.3% diagnosed with influenza, and 0.01%, very low for RSV. The positivity rate for COVID is 6.3%, down slightly. Influenza, 2.54%. down a little bit, down about almost 9/10 of a point. And RSV at this time is 0.43%, just up ever so slightly. Not a big deal at this point. All right, let's now take a look at some data from CJS 83172, and this is where we're going to end today, which I did not include here. And I should note, he talked about 2 states are now starting to include the full hospital picture, and if those 2 states mean anything, guess what? The number is significantly higher than what we had been seeing, because they saw a significant increase. I'm going to remember to include that in tomorrow's video. I'm going to make a note to myself. All right, let's go to some daily-weekday reporting states. Florida, 311 new cases and 14 new deaths. New Jersey, 537 new cases and 1 new death in a 2-day update. New York, 325 new cases, which that is yesterday's reported number in New York. Now to some weekly reporting states. Arkansas, 116 new state reported hospitalizations. Arizona, 1,788 new cases and 16 deaths. Delaware, 122 new cases and, wow, 25 new deaths, much of which was likely from a death data dump. We're not done with death data dumps yet. There's going to be more on here. Indiana, 1,260 new cases and 13 new deaths. Maine, here we go. Here's another death data dump. 310 new cases and 23 new deaths, much of which was likely from a death data dump. Maryland, 489 new cases, 16 deaths. Michigan, 1,936 new cases and 15 new deaths. Nevada reports 335 new cases. North Dakota, 324 new cases and 2 CDC reported deaths. Oregon, 151 new positive tests, a test case positivity rate of 4% and 13 new deaths. South Dakota, 322 new cases and 5 new deaths. Tennessee, 1,289 new cases and 12 new deaths. Virginia, 1,791 new positive tests and 15 deaths. Washington, 229 new state-reported hospitalizations and 18 new deaths reported in that state. So I think we covered a lot today, don't you? That does it for today's virus update. We'll have another update tomorrow with brand new CDC data. I do believe this is the week where we will see variant data. Of course, we'll see data from more states and whatever the news of the day is tomorrow. So stick around tomorrow, or check back again tomorrow for that. If you enjoyed this video, give it a thumbs up. If you're brand new and you like what you just saw and you want to continue seeing updates like this, well, you can help me out by subscribing down below, because the more people that subscribe, the more people I can help keep informed. And of course, share this video with anyone you know. Leave your comments down below and remember to hit that notification bell. I will see you all again next time. Until I see you again next time, stay safe everyone and have a fantastic Thursday afternoon. Thanks for watching.